So good morning, everyone. Thank you so much for agreeing to participate in this month's Equity Matters. Equity Matters is a webinar where we try to spotlight our community partners and our services that we offer here within New Hanover County. So this month we will be talking with many of our health leaders, and they will be talking about National Minority Health Awareness Month, and specifically in terms of minority mental health. So we're going to go around, we're going to introduce everybody here, and then we will get right into our conversation to maximize time. So on my screen, to my right, I have Ms. Leslie Wilder. Welcome, Ms. Leslie. Would you like to tell who you are and where you're from?
Oh, yes, thank you. Good morning. I'm Leslie Wilder. I am employed at New Hanover County Health and Human Services. I am one of the licensed clinical therapy supervisors for our school mental health program. So we provide mental health services for elementary and middle school students in New Hanover County.
Excellent. Thank you so much for sharing. Welcome to Equity Matters. On my screen below Ms. Wilder, I have Ms. Sharon Dickey. Welcome, Ms. Sharon.
Hi, good morning. Thank you so much for having me today. So yes, my name is Sharon Dickey. I'm a licensed clinical mental health counselor, and I'm the owner of My Reason Why Counseling Services, PLLC, which is my private practice.
Very good. Thank you, Ms. Sharon. Welcome to Equity Matters. On my screen next to Ms. Sharon, I have Dr. Jocelyn Hunter. Welcome, Dr. Hunter.
Morning. Thank you for having me. I'm Dr. Jocelyn Hunter. I am newly employed by Coastal Horizons as the Director of Diversity, Equity, and Inclusion. I also am a mental health therapist, and I'm glad to be here today.
Thank you so much. And above Dr. Hunter, we have Ms. Liz Udakakai.
Uskategi.
There you go. I tried. Let me tell you, I practiced and I tried and I practiced and I tried. So it wasn't without effort.
It's okay.
So could you share with us your role and what do you do?
Yep, my name is Elizabeth Uskategi. To give you a pronunciation key, who's got the key?
Who's got the key? I love it. I love it. Okay. Thank you. Thank you.
So I am originally from Puerto Rico, and I am the licensed clinical social worker and program director for Clinica Latina at Coastal Horizons.
Okay, well, thank you, Puerto Rico. Oh.
Just got back the other day, 2 days ago, so my head is still at the beach.
Very good. And we just want to share, we did get approval. Ms. Liz is dealing with some light sensitivity, hence the reason why she has shades right now. So let's extend some good feeling, good vibes to her so her eyes can feel better. So we want to thank you so much. We all for you all coming here today. Mental health is it's the topic of the moment, right? Because we realize that many of our historically marginalized, underserved, and adversely affected populations definitely are impacted by lack of mental health in terms of providers, services, being connected in terms of access to services. So when we have that conversation, what does that look like for you all? Are we seeing an increase in mental health issues? And are we also seeing an increase in people getting plugged into care? And it doesn't have to be where anyone specifically answers. Anyone can answer and chime in to that conversation.
Definitely on our side at Clinica Latina, we're seeing an increase in people reaching out for services. Huge increase in the number of people coming in with serious mental illness, schizophrenia, bipolar, lots of clients with a lot of like hallucinations and delusions, where I'm just questioning like what's going on, what's all this coming from. So we've been open since 2009, and I've not seen this. I've been there since then, and I have not seen these many referrals coming, out of the hospital for serious mental illness in the Latino community. So it's very concerning to me, and it's, either I'm questioning it. are we getting better at diagnosing and finding these? Are people accessing, the mental health resources better? Or things, are we missing things? Is the interpretation services, missing questions, or not, the translations are not, good enough, and so people are getting misdiagnosed or whatnot. So lots of questions in my head about it, because we know what research tells us about the percentage of people with serious mental illnesses and that sort of thing, but huge rise in that for us, for sure.
So, as you were talking, one of the things I did want to backtrack just a little bit, which I didn't define. Dr. Hunter, could you share with us when we talk about mental health, could you give us a definition or kind of a catch-all, the navigation type of way when we talk about mental health? Like, is it one thing, or is it kind of touch on many different things? Could you kind of expand on what we talk about or what we're talking about when we say mental health?
Sure. I think it depends on who you're talking to, and what community you're engaging, to be honest. I like to talk about mental health as a spectrum. A lot of people, when they mention the words mental health, they are thinking of disordered functioning, like something is wrong, right? Or those kind of negative connotations like being crazy. But I like to share, one thing I share in education, especially with youth, is that we all have a mind, therefore we have mental health. Now, where your mental health is, right? The status of your mental health can fluctuate, it can change over time. For example, if you have the loss of a loved one, totally normal to be feeling more emotional or more sad. But also, when we talk about mental health, sometimes we're talking about mental illness, which in some ways is defined by things that we're trained, like all of us on this line, engage in direct practice and care with folks as mental health clinicians. And so when we talk about that, we're talking about things like diagnoses, like Liz mentioned, and those are the things we consider mental illness or mental health disorders. But I think it's on a spectrum. I think people experience mental health challenges that are maybe don't meet the criteria for being diagnosed. And I think there are other who meet criteria for being diagnosed, but never get seen by a clinician. So I just like to remind people at the end that mental health is a very wide spectrum. And if that people feel like they're struggling and are having difficulties, the key is to try your best to get help. I know we're talking about equity, right, for certain communities today. That's not lost on me. And so I know access is definitely something to be discussed, but mental health is very broad. If you have a mind, you have a state of mental health at all times.
I love how you brought that out. And that's so important how you actually painted that picture, because I think a lot of times when we have these conversations about mental health, we're only talking about in challenging situations, right? So as you stated, when someone may be having a panic attack, someone may be having a schizophrenic outbreak, or, and if that's the wrong words, I do apologize. But they have a challenge. They're having a challenging moment, opposed to understanding that mental health is, if you have a mind, it's about the condition and the health of your mind, the optimal conditioning of your mind, wherever that spectrum may be. So I love how you define that. When I'm gonna jump to Leslie. Leslie, when we talk about school mental health, could you break that down so we can understand clearly when we say school mental health? Is there any difference between the two?
There's no difference, and I would agree with Dr. Hunter in terms of the spectrum. And we can jump on and off of that spectrum at different places of that spectrum over time. And we look at also things that are chronic and things that may be temporary. A lot of times when we see children coming into our school mental health program, we're dealing with things that are more temporary. And mostly that's based on age. And so when I'm looking at the referrals that are coming in for our school mental health clinicians, a lot of those things are surrounding depression, anxiety, school anxiety, family configurations, whether, nuclear home, extended families, things like that, and how kids are adjusting to those challenges that are coming along for them. I will say, though, going back to your earlier question in terms of where we're seeing the most need, we have 34 mental health therapists in New Hanover County in our elementary and middle schools. And when we ended this past school year and the previous school year, we had waiting lists, which is very atypical. And I know that a lot of that has to do with the pandemic. We are still seeing ripple effects from the pandemics, particularly on our children, because you have to think about it, they lost 2 years of their social development being out of school. I mean, they weren't technically out of school, but they were away from their peers. They were away from their classrooms. They were away from their teachers, who are sometimes their role models. They were away from those social constructs that give them the ability to know and to kind of gauge, am I fitting in? Am I outside of the group? Where am I on the spectrum of normal child development? Like, do I have a connection with others in some way? And so we were starting to see what we would consider even the most well-adjusted kids having difficulty. And so that definitely brought a new light on where school mental health is so important.
Yeah, thank you so much for sharing that. And that's actually where I should have started with the definition of mental health, and then going into those spaces. And I like the fact you also brought up the awareness of the increase in numbers. When you talk about the increase in numbers, Sharon, could you tell me, what are you seeing in terms of general population? I know for you also work with many of our military families. Am I correct?
Yeah, I do that as well. But with my private practice, what I love about the trends that I'm seeing now are minority populations coming in just to make sure that they are at a level where they feel mentally well. So I'm seeing more of them coming in because they want to be more preventative and using mental health in the way that we would love for everyone to use it in a more preventative way. So that's what I'm experiencing in my private practice, which I'm enjoying. But I also do still have some people as well, like Leslie was speaking about, that are having those residual effects from COVID, even still today, even with the adults, still adjusting, getting back to life, and adjusting with the time that was kind of almost lost, and figuring out how to pick up and keep going. But, still getting those other mental health issues that we would consider being a little more than just stress, right? So the depression and the generalized anxiety disorder and things like that.
When you use the term of mental wellness and being proactive in terms of mental wellness, what does that look like?
It's different for everyone, right? So what I feel is mentally well for me may be a little different for someone else. So it's where we feel comfortable in our mental state. I may be able to take a little more stress than you can, so I may feel just fine at a higher level of stress where it may be too much for you. So just gauging where you feel comfortable, where you feel like you can function what you consider to be normally in your day-to-day activities.
Okay. And Liz, when we have these same conversations in terms of our Latin American community, how popular is it in terms of having these conversations about mental health, mental wellness? Do you see within our Latin populations?
The mental health is not a common theme or topic in our communities. In Latin America or Latinos, Hispanic communities. So it's a little bit more of a taboo. So a lot of our clients come in, worried about, are they going to get labeled as crazy? So that's the first thing I have to say. And I kind of joke about it and I say, this is not where the crazy people come. So there's another place for that. And then, that kind of just helps them feel like, okay, I'm in the right place. I'm not crazy. So kind of just lets them come down from feeling, anxious and feeling that they're going to be labeled. So it's, these are not common things, or themes in our communities. It's very expensive, even in our own countries, to get mental health services. So many people don't. And there's no way of knowing what was there before, as far as in my history, my parents' history or anything like that. So it's, it's very difficult. And so we have to we have to start at the very, very basic.
Mhm.
And, defining a lot of these terms for our community, and really getting to earn their trust, and lowering down, those expectations and lowering down that fear and that anxiety.
Yeah, I like how you said that. That is very true, especially when we talk about access to services. I know recently there was a conversation that our President Biden, actually, I think it was yesterday or the day before, and he was talking about mental health access and the cost that was attached to it and the challenges getting connected into insurance and the different ways of how it's being billed or is not being billed. And so when we talk about access to services, the cost can be an issue when it comes to people actually getting into care. Can you all kind of speculate on why that when it comes to mental health care specifically, that the cost is so exorbitant for our clients?
That's honestly a question I have myself. Because when I go to the doctor, all I have is a $25 copay. But with my clients in private practice, if they have, sometimes their copay is almost the same price as what I would charge just a self-pay rate. So it's really not giving them a discount or, causing them to be able to access mental health care in an affordable way as we do for our medical health care.
I think also with most commercial insurances, therapy is considered a specialty or seeing a specialist. And so you do have a different copay or a different rate for that also. But I will say for our program, we are in the schools, obviously, like I said, so we do have a memorandum of understanding with the school system so that if a child is uninsured, we will still see that child.
Okay.
And I think we're pretty unique in that. But we also do bill for health insurance, but if there's a copay, then that piece is kind of absorbed by the county. So there's never going to be an out-of-pocket cost for the parent when they come into our services.
So Leslie, is there a certain amount of times, a limit to the amount of times that a child can be seen? And when we talk about the care that you're providing for school mental health, is that also inclusive of the parent, or is that solely just for the child?
It's parent and child. So we do individual and we do family therapy. But in terms of the number of sessions, no, there's no limit. Particularly when we're using private insurances, there's no limit. When the child is uninsured, there's absolutely no limit. But then if a child does have Medicaid, we do have to follow the Medicaid rules in terms of having them reauthorized for services once those initial units have been used.
So how does a child get plugged into care? Is that through a recommendation from the teacher, through the counselor, or how does that begin?
All of the above. All of the above. So it can be a teacher, it can be a parent, it can be an administrator from the school, it can be a pediatrician outside of the school, a relative, whomever can complete our referral, and then we'll reach out to the family.
So that in itself is really good to know. And because if you have children and your children are in the New Hanover County school system and you're seeking mental health care, that can actually be an inroad in order for you to be able to get care. Am I correct with reaching out and for whatever your reason, right? You reach out, my child is in school, we would like to do family therapy together, or my child would like to be seen. Now, would you see the parent separately? I think you said, I didn't clearly hear that part.
It can be a combination. We can do individual with the parent, individual with the child and family together. So lots of configurations.
Okay. All right. So that's very good information. What about at Coastal Horizons, Dr. Hunter? How do you all provide care there?
Yeah, I was thinking about a bridge from what Leslie was sharing, that similarly, there are lots, and I don't think a lot of folks in the community know this, there are lots of free and affordable services, in particular, counseling and behavioral health for youth and crisis sort of intervention services if a youth needs shelter, which is actually available 24/7. I would say the primary bridge from what Leslie's sharing around elementary and middle would be maybe the What Clinic at Coastal Horizons. And the WHAT stands for Wilmington Health Access for Teens. Teens can actually go there. I would say preteens to teens, age-wise, could go to the primary care clinic and receive free to affordable care. That's for adults as well, adults and youth 12 and up. And also receive either school-based, so there are counselors seated in the high schools, or outpatient therapy if they prefer to come to the WHAT office at Coastal Horizons. So if people were to access the website or just search WHAT clinic, WHAT at Coastal, they could definitely access free to affordable to free services, I would say, depending on what they're seeking at Coastal. And Liz is the long timer at Coastal. So Liz, if I ever like misspeak or I forget something very important, plug it in for me. Yeah, but there's a lot of accessible care at Coastal that I think people are not necessarily aware of, for
Yeah,
sure.
I have to agree with you with that. There is, in terms of Coastal Horizon, I will say that there are many different inroads that you can get in when it comes to care with Coastal Horizons. When we look at the scope of mental health and mental wellness, what are some of the challenges that you all see the most or hear in terms of conversations within your kitchen table conversations that you have with your friends and family? You know, how does that, what are some of the topics that you all run across that need to be publicly addressed?
Can I add something, Fawn, just as a tag on to Coastal? I'm excited to be on a call with folks of color who are engaging in mental health care. And I would just say, just to even start it off, one of those topics is like in our training, right? We use all these fancy words like therapeutic alliance. I think Liz kind of hit on this too, but it's really relatability. Like folks wanting to see someone who just gets it. Like they'll say, you just get it, right? So when I have clients come to me, this is outside of Coastal Horizons, disclaimer, they will say, like I heard Leslie mention earlier, waiting list. There are waiting lists, and a lot of clinicians of color in our area have waiting lists, and it makes the care just even less accessible to the folks who need it or who are wanting to get it. And so I think that's a big theme that we talk about often. There are not enough clinicians of color, and then the ones that we have in the community are tapped out. Like, what do we do about kind of expanding that so that people can get the services that they need? And something you mentioned earlier, which is trust. So someone will call and say, my sister sees you, so can I come in now? And it's like, oh, but we're on a waiting list. You know, what do we do about that? So just something I wanted to raise. Yeah.
And you know, and that's a very good point that you're making, because I will tell you personally, I've had some challenges in terms of my own mental wellness. And I have struggled with reaching out to counselors here in the area because of how small our county is. And because in the intersection of everybody know everybody. And so that trust component is really, really important, because if I come to you, Dr. Hunter, and you and I travel in many of the same lanes and spaces, then we want to be able to be comfortable to say what I say with you stays with you, you know, or if I see you out at a different event, you know, Sharon or Leslie somewhere, if I see us out, you know, I want our conversation to still be cool and relaxed, but then at the same token, you know, I want you to give me the side eye because I just got through telling you, you know, I don't know, some odd thing, you know, or something that's close to my heart. And so I think that that's important, especially when we talk about New Hanover County, specifically the size of our county, the close proximity that people have in terms of their connections with everyone. So when we talk about developing trust, what are some of those things that you do to help? I mean, outside of the oaths that you have in terms of a clinician, but what are ways that you do try to instill or establish trust with someone to let them know, like, you're okay, it's a safe space for you to tell me what's on your heart?
Well, fine. I actually say just that whenever I meet my clients in the initial consultation. But just to back up just a little bit to Dr. Hunter, I think we as clinicians, Black clinicians, need to connect more in New Hanover County. And if there is a connection that's going on that I'm not a part of, I definitely want to get into it because I don't have a waiting list with my private practice, and I am available to be able to meet that need and close that gap. And you're absolutely right. Sometimes we just want to talk to someone who looks like us, someone who has experienced our culture, you know what we're talking about without having to say so many words, someone who gets and just understands. And that's my main purpose for even opening my private practice. And that's what my Reason Why Counseling Services does. I fill that gap and I fit that need for people who want to talk to someone who looks like them. And I do get a lot of like female clients for that reason. So truly, truly, truly loving my practice. But I think having that access and knowing who we can refer to is going to be the key.
It really is. And what you're talking about in the, I guess you could say in the technical language is called cultural intelligence. Having cultural intelligence that allows you to be able to level set with your client and being able to empathize and to understand what they're saying, how they're saying it. And like you said, I get you, I see you. That's another way of just saying, I see you. I know what you're going through. And I think that is a challenge that many providers are experiencing in certain spaces because they don't get us. When we have these conversations in terms of cultural intelligence and minority health, one of the big conversations right now that everyone is talking about is minority maternal health and how many of our providers are not having that cultural intelligence and not connecting into the care that Black women so desperately need, and why many of our, not many, but we are experiencing or seeing many Black women pass away because, or experiencing traumatic maternal birth stories because there's no connection in terms of cultural intelligence. I see you, I understand you, I connect with what you're saying. So that's really important. Representation does matter in how we provide care, but also allowing people that space to be who they, to authentically be who they need to be. One of the things that you said, Dr. Hunter, was important when we talk about access to services and that bridge. What ways can we be better with building that bridge for people knowing about services here in the area?
I think what we're doing right now, community conversations, having dialogue, making connections. I wrote Sharon's name down because Sharon, you ready?
Thank you.
I think this is really important. And I think some people are afraid to talk about it. I love that you explicitly had this be named about equity and saying minority mental health matters, because it does. And unfortunately, in the environment we live in, the space we live in, the where we live, sometimes those conversations are hushed. But I think the more we can boldly dialogue about it and connect, because there's so many resources out there, it's just helping to connect the dots and making it easier for people to access it if they need it. Yeah.
Yeah, New Hanover County is a very resource-rich county from what I found in terms of services. And to your point, as far as the population is concerned, New Hanover County approximately is about 13% Black, and we're approximately about 7% Hispanic. And so what that says to you is that there is a huge disparity when it comes to access to services for our minority community, because it's because just by the nature of the community that we're living, it's not anything intentionally done. It's just the community that we're in, if that makes sense. And so that means there's less providers of care that are there and available for people to go around to and to get in connection with. One of the things I think that we could be better about is definitely sharing. Sharing and not operating in a silo. I think a lot of times that we get so tunneled into the work that we're doing that we don't reach out to find out, what is Liz doing over at Clinic Latina? What is Leslie doing, with the schools or with New Hanover County segue into the schools, not the school system. So let's be clear, she doesn't work for the school system. she works for New Hanover County. And so just how does that work? How we play out in those services? When you all provide services at Coastal Horizons, what are ways that you think that you all can be a little better with providing equity?
Me or Liz?
Roll the dice. Y'all play the game.
Go for it, Liz.
I think definitely we need to be more intentional, and I think we've been trying. It's really hard finding people bilingual people, finding Latino clinicians. It's really difficult finding clinicians of color, that are out there. And then when you do find them and they get seasoned enough, then they want to, leave and go do private practice. And so not criticizing anybody here, anybody that does this, right? Because everybody has their own goals and their own passions in life. But so when that happens, then, a lot of the times people in private practice, their services are no longer affordable to the people that they want to serve, right? That they intentionally went out to go get degrees and go get, all of this, do all this work for sometimes in the first place. So then, but I get it, you also want to make a living and you also want to, grow, right, and expand as a person, as a professional yourself, and you have a right to do that, right? So as we bring in new clinicians, and as Coastal does, what we see is sort of like, we're a training ground, right?
Mhm.
And then people leave and they go off to private practice. And so then we have to go, intentionally continue to find new clinicians of color, new clinicians that are Latino or bilingual or whatever, right? And so it's very difficult, but for sure, doing more of that, Coastal has programs in many different counties, not just New Hanover, but all the other surrounding counties. And that's important because a lot of our surrounding counties do what? They come to New Hanover County and to use up the resources in New Hanover County, right? So it's important that we can share the wealth and that we can expand outside of New Hanover County. And that I feel like New Hanover County and our surrounding counties need to work together a little bit closer because we are smaller communities. At the same time, you've got Pender County, Brunswick County, sucking at the resources from New Hanover County because they have to, right? Because there's nothing out there, right? Or very little out there. So how do you work around those issues? But so Coastal Horizons does have programs outside of New Hanover County, a ton of programs outside of New Hanover County as well. But again, just not enough staff to do that, to provide those services. How do I want to say that? And so there's a waiting list, right? So it's hard to really expand it, to expand services. And like, it's hard for me to expand Clínica Latina services and have it grow bigger because I don't have the personnel, I don't have staff, I don't have a waiting list of people trying to get a job, right? Because it's just not there.
I got you. I understand.
I want to add to what Liz is saying while we're on Coastal is part of the goals in me in this DEI director role is similar to what Liz is saying. Providers from Latinx community, BIPOC providers, those that are LGBTQIA plus friendly and allied. It's important to get more providers there. Coastal serves about 57 counties, some programs 53 counties. Some people don't know that. They just know like Shipyard, right? So they're like, oh, 615. But Coastal serves, oh my gosh, so 50 plus counties, 600 plus staff. It was interesting that Liz brought that up because I first started at Coastal as a therapist part-time, right? And I was like, oh, I got some of the best training I ever got, and then I left. So it's really nice to be able to come back in this role and kind of have more of, there are obviously people there that are very seasoned, right? But having kind of the full circle look at what it looks like to be a therapist, receiving training and supervision, and then leaving, and then coming back and saying, what are some of the things around equity we could work on? One of those things, one of the goals on my list is recruiting and retaining, right, providers of color, because it's needed, right? It's recognized and it's needed, while also understanding that it goes beyond New Hanover County, and also that there are amazing professionals of color that are outside of like those counties even, right? So reaching out to HBCUs, reaching out to Latinx serving colleges, community colleges, trying to make those connections and relationships, and hoping that we can bring and retain some great providers to Coastal. It's not easy to do, right? There are other things that have to be addressed to make sure that we can attract, right, and maintain. Like they say, give folks of color a seat at the table. And I'm like, are they going to stay sitting, or are they going to get up and go to the restroom over and over, you know? And that's not just Coastal related. That is Wilmington, New Hanover County, surrounding counties, right? That's sort of the nature of where we live and things that happen at all the great agencies here. So it's hard work. I think also, like how we always say, meet people where they are. I know I have some fellow social workers and other mental health professionals on the line. So meeting clients where they are, but being very like physically maybe having to meet them. Like I know Coastal has taken on a lot of mobile services now because of that, that there are rural counties that don't have easy access, but also maybe going to places to build the relationships and sharing with them in their language, right? That this is what Coastal has to offer. Yes, it's free and affordable. Yes, I can attest to the fact that it's trustworthy, that you can go there and trust that you will be taken, you know, good care of, and things will remain confidential and private. So just being more proactive and intentional about that, at least on the Coastal end.
Thank you for
Yeah.
sharing. Sharon, what are your thoughts on where do you think that our organization can be stronger in terms of providing equity in mental health services, for mental health services?
You know, we have to, I think we have to work together more. And then just from the clinician perspective, just from the previous question, I'll come back. You know, from the clinician perspective, the person that actually does the work, right? I've been in intensive in-home, I've been in family-centered treatment. And in order to work community-based services, it's also it's a challenge to grow as a therapist in your career. When you're in that space can sometimes be very limiting. So I wish it was a way to expand it for the clinicians so that we can grow in that space. And not stay on an entry level type, you know, lane. So I think that would be something great for community-based services, to be able to find a way where the clinician can actually grow as they, you know, gain more tenure, you know. But yeah, so just working together as a community, using each other as resources, knowing who I can refer to. Can I refer to you? Can I refer to you? Who's available? And then just understanding the needs of our community. And understanding that a big thing that I see with a lot of my clients, they typically go to their doctors first, and then their doctors either aren't able to help them or actually refers them to me, which has been great. But we have to understand that sometimes our symptoms present a little different. So understanding what we're looking at. So if I go to the doctor and I'm complaining about pain in my body, my doctor, after they do all the tests, right, you can't find anything that's causing this pain, but they'll give me the pain medication to treat the symptom. But the root cause of whatever my problem is has not been addressed. And what's often missed with our community is that pain is presenting it's stress in our bodies that's presenting as pain. So you're not going to find it on a medical test. It is a mental thing. And it's something that needs to be worked out with the therapist. But when you come to me and I ask you about your day, I can tell you why your back is hurting and why your leg won't stop hurting. You know, I can tell you all of these things because I also understand the culture and I get it as well. So I think just being able to understand the culture, the minority culture, and how our issues present very differently than others, and understanding that it's just because I'm angry and frustrated, I may understand that as pain, hurt, and disappointment, and not intermittent explosive disorder or something, you know, or something worse than that, because I get it, I understand. So I think that's going to help with access and addressing the equity issue.
Yeah, I'm gonna come to you, Leslie, but and I have a habit of being vulnerable, so I have to share this because you are driving down my street, Sharon. I mean, you are literally driving down my street, and so just being told to transfer. I went to the doctor yesterday, and I was just sitting there. Dr. Jarrett says, "Hello, Jocelyn."
Hey, Dr. Jared.
Just sitting there.
Provider of color. We need it. We need more of it.
Yes, I love Dr. Lakeisha Jarrett, Wilmington Health, if you're looking for a Black female family medicine. But I was just sitting there in her office yesterday and I was just like, I feel horrible, Dr. Jarrett. And just going through everything that we were having our conversation. And she said, Fawn, have you considered connecting to a mental health counselor? That just meant everything because she didn't decide that she wanted to give me some kind of pain pill. She didn't say, that, maybe you should try this other, medication or anything like that. It was, she really listened and made a recommendation. And she was like, you know what, you might want to consider getting connected into mental health counseling. That is everything. That is so true in what you're saying, Sharon. It's understanding that the pain that you're experiencing or the symptoms that you're experiencing may not be directly, is the term physiological? They may not be physiological symptoms. It could be stress that is being amplified in your body and showing up in many other spaces in many other ways. And we need providers to be able to understand that. It's not always a pill issue. Sometimes it could be, but it may not, and so maybe just getting plugged into care will help you be in a space to be able to talk and to help bring that down. And so now you no longer have high blood pressure. No longer you have, some of these other issues that you're dealing with. It's very important to have someone to be able to listen and to be able to say, have you considered? And then also think about, it could be mental health. It may not be physiological. So I love how you brought that up. And so I just had to share my story because there could be other people out here who are experiencing the same type of thing. And I know one of the terms lately is gatekeeping, and I don't like to be that gatekeeper of experiences. So so just think about it, gentlemen and ladies and others, that you don't always, the experiences and the health conditions that you're having, it may not be a physiological situation. It really could be directly related to stress or other mental health issues. So just, pause for the cause in that space. But Leslie, I'm running over to your space. What are areas that you think that New Hanover County Health and Human Services might be able to be more, to improve more in terms of equity for our school mental health area?
Well, I think first and foremost, addressing mental health challenges early is always going to be a benefit. I think it's a benefit to the student. I think it's also a benefit to the clinician because, we're not magicians. We're not able to just wave a magic wand and fix a child the way that some parents would like us to, or the way that some school administrators would like us to. Sometimes they'll bring a child into our office and say, hey, fix them. And we can't do that. But we, in conjunction with others, with a multidisciplinary team, we can work together to find out what's going to be best to serve the student. So I think early identification and early interventions is always helpful. And I also think looking at lowering the rate of suspensions and increasing the rate of mental health referrals will help tremendously. We get so many students that are finally referred to us after they've had multiple suspensions. Well, let's back up. Let's try to think about it in a little bit different way. And I will say, the rate of suspensions for children of color is exceedingly higher than the rate of suspensions for children who are not. And so I think that's a place where we have to look for equity as well, in that some children will get a referral and some children will get a suspension. So we definitely have to pay closer attention to that. And I will also include, when you were talking about the cultural intelligence of wanting to have a therapist who looks like us because they get us, I 100% agree with that. And I don't take anything away from the value of having a therapist who looks like you, sounds like you, has had similar experiences to you. However, when we're talking about mental health care, I just want people to see someone. I want people to get in touch with a therapist. If I had cancer and I wanted an oncologist of color, but I can't find one, I'm not going to wait to treat my cancer because I can't find an oncologist of color. I want to go to the best oncologist that I can find. And I think we have to look at mental health in the same way. Yes, it would be more comfortable for us. It would definitely give us that sense of, I don't have to explain myself so much if I'm in with another African-American therapist. I don't have to explain my history so that you finally can get to understanding me. That's huge. That could take 3 or 4 sessions. But when you can go in and immediately start addressing the problem because you have this shared understanding and shared experience, that's great. But if that's not available, the message I want to get out to people is, don't wait. Find a therapist that you can connect with on some level and get to work and start making those changes that you want to see.
And that's a very important that you said that also. And one of the things I think about is not every person of color is going to be able to identify with other persons of color, right?
Absolutely
And
true.
so we also have to leave into that space that, just think about how long it gets you, that it takes you to get comfortable with just finding, a regular physician. You might go to 2 and 3, I know when I was pregnant with my son, that I went to a couple different OBGYN until I was able to find that OBGYN that I was able to connect with, and she was a white female, and so it was important for me to be able to just find somebody that I could connect with. And I think that we have to allow space for that also. So although you may not be able to connect with someone in terms of representation, which as you clearly define, that's extremely important, but more importantly, start the process. And until you can find someone, maybe of color, but let's see if we can find you a clinician that can actually help you and help get you plugged into care and help you get connected into services, or give you actionable things that you can do at home that's going to help you. And I think that that's 2 conversations that we should have when we talk about mental health care quickly. I think a lot of times people don't realize that there's work in mental health care that you have to do. They think I just go in, I go sit down, I pour everything out, verbal vomit on my clinician, so to speak, and then it's all better. So there's a lot of work to the process, and would you all say that, Sharon or Dr. Hunter?
Oh, absolutely. I'm the one that's doing the least amount of talking when you come and sit with me. So yes, absolutely. You have to come in knowing what you feel like you need help with. And then as we talk, I'll probably help you identify a few more things. But it's what you come with. So someone said earlier, we meet the client where they are. So I'm meeting you exactly where you are and what you're presenting with, what you feel you need to work on, and then I'll help identify some other things, and we'll help get you all together.
Yeah, and I was gonna say, I like the message that you're giving right now, but it made me think of, do y'all know the equity visual? I know everybody hasn't seen it, so maybe people will then go look up. So where there's someone who's assumed to be more privileged standing on a taller box, right? Looking over a fence in like a grassy area or field, and there's someone next to them who has just one, right? Or is shorter, doesn't have as easy of a view. I keep thinking, whenever I see that now, as being also public health trained, I think like, where are they? Like, how did they get to that field? Like, is it on a bus line? I'm thinking about all these other factors. And so I have to challenge myself too, sometimes as a therapist. I think sometimes we make the assumption that I think therapy is extremely important. So as a therapist, I also engage in therapy for myself, right? Practice what we preach. And we hold a lot. So it's helpful to have someone else. Yay, look, fun. So pulling up the visual of the equity. So I'm like, what is this field? Is this a game? Did they have to pay to get in? Like, did they catch a ride? Did they have to catch a bus? That kind of thing. But also, and I love that this one, because early visuals like this, Fawn, didn't always include the person in the wheelchair, right? So are they differently abled? Like, can they actually stand on the box or the stair or whatever it is they need? I think we have to think not just outside of the box, but away from the box. Like some people will never make it to a couch. Some people will never come to therapy. And that's just, the facts are the facts, right? As much as we're advocates for it, we know that it's helpful. Some people will never make it. And so I think equity, in particular for minoritized communities, also means, can we provide psychoeducation in the community? Can we have discussions around coping skills? Can we do seminars? Can we provide, because everyone is not going to come to therapy as much as we would love it, right? And so I think it's like, twofold, like for the clinicians, more representation, and also seeing, to Leslie's point, seeing a provider if you cannot get to a clinician that looks like you, but also what if they never come to a clinician, or they don't want to, or they're not ready? I think we just need to think more broadly, like, can we, develop more books together as a community, right? Can we provide more free resources? Can we do seminars and psychoeducation? I think those things sometimes are more welcoming and more accessible. So just thinking more creatively about what equity could look like for minoritized communities. And that's not always how can we get them counseling or therapy, in my personal opinion.
I agree with you. I think when we talk about health equity, right now as we're having this conversation, one of the elephants that's in the room or not in the room is males. And so often when we have this conversation about health equity in any space, whether it's medical space, whether it's just whatever that space may be, women are always showing up. We're always at the front seat, so to speak, at the front of the bus. How do we get our males involved? How do we get our men having this conversation, our boys when they're inside of school, and teaching them coping mechanisms inside of school, and getting people to understand in terms of school that maybe that child is not acting out. Maybe he's a kinetic type of learner. So he's got to stand, he's got to move, he's got to be about, moving about, opposed to always just being set, in one space, which causes him to act out, which causes him to be suspended, which causes him to be right? The steps that it continues to go. So how do we get our men engaged in this conversation when we talk about mental wellness and mental health? What are your thoughts in that space of health equity? And we had a man, but unfortunately he wasn't able to show up.
Yeah, I know for me, I'm always looking for a male clinician, especially a Black male clinician to refer to. It's just needed. They are the true unicorn, I believe, when it comes to mental health clinicians. But yeah, when I worked at, when I did some time at Lake Forest Academy, you kind of took me back to that time and place. We did a lot of that type of work because there were a lot of Black male students there, a large population of Black male students that needed not only the mental health aspect, but also like the mentorship. And a great thing when I was there at that time, there were quite a few Black male qualified professionals there that were able to give the mental health assistance that was needed, as well as the mentorship as well. So being able to kind of pull that out to, private practice or these other environments, it's definitely a need for it.
I think it's more education, more exposure to, having these conversations, these topics, more, having more space and more opportunities to have these types of conversations and not, shying away from these conversations. But I wanted to say also that as we're talking about equity and we're talking about having more clinicians and more people of color and more minorities being represented, everywhere. But when we're talking about equity, it shouldn't matter. It shouldn't matter who I go see. I should be getting what I deserve to get. I should be getting the healthcare, the mental health care that I should deserve to get, no matter who I am. And I should be understood. The person on the other side seeing me should be making all attempts to understand me, to hear me, to reach out to me, to connect with me, no matter who I am, no matter how well I can afford the care that is being provided to me. And I should be feeling comfortable that I am confident that I am getting the best healthcare, the best mental health care from you, no matter what. That's what equity is like.
You're
I
muted,
can't hear
Fawn.
you, Vaughn.
You're muted.
Your mic is off.
Oh, I'm so
There you
sorry.
go.
That's exactly what equity is. You clearly said it. It shouldn't matter who I am, any of that should not matter. Where I'm from, what my finances say, what my finances don't say, what my background is, how I identify, how I don't identify, what my race is, what my race isn't. At the end of the day, what it really matters is getting me personally the curated care that I specifically need. What do I need in this space, in this moment, in this time, in this place that I'm having a conversation with you? What do I need? And can you get me plugged into services if you cannot do the services for me? That, and are you willing to be that bridge that help me get that connection for me? You may show up at my front door and I may not be able to help you, but am I willing to drive you to where you need to be, or make that phone call to where you need to be, or send that email to that person, or send that text and say, so-and-so is on their way, opposed to me saying, you know what, unfortunately, I don't provide those services, and that's it, full stop.
But then you do that for somebody else.
There you
That's
go.
different from me. You're willing to do that for somebody else.
Exactly.
That's the problem.
That's exactly
So
right.
because then that's not equity.
That's not
But
it.
you give me the services that I need when I need it, as I need it, because you just showed that picture, a minute ago.
Mhm.
I don't need a ramp to get up on to
Mhm.
look over the fence and see the game, right? Because I'm not in a wheelchair. So don't give me that. But I might need a ladder, because
You
I'm
might need a
short.
visor because your eyes are sensitive today.
I need a visor, right? I need sunglasses. So, give me what I need, right? And I'm not gonna complain about you giving somebody else. You give Jocelyn, for example, the ramp. She can have that ramp.
Mhm.
As a matter of fact, I'll help push that ramp over there for her.
Mhm.
You know what I mean? But at the same time, do not neglect my needs, right?
Mhm.
As we're helping Jocelyn get what she needs, right?
Mhm.
And it should be wherever and wherever I am.
Mhm.
So as we're talking about all these different ways of how can we bridge that gap, and how can we make services more equitable and whatnot, we need to also understand that there's work that providers we need to do, no
Mhm.
matter what color we are, no matter who we are. Because I'm Latina, we have at Clínica Latina, we do see children and adolescents that are not Latino in our clinic. And we work with those parents as well. And no matter who it is that walks in through that door, we're going to treat them with the same amount of respect and courtesy and understanding, and as we would any Latino. And then the same token, we don't pretend to understand every Latino culture that walks through that door. There's many Latino cultures.
That's right.
And I'm not going to pretend to understand the Dominican culture or the Venezuelan culture or the Colombian culture. I'm from Puerto Rico, and these cultures are very different. So I still have to stretch myself, and I still have to make room to understand, to comprehend, to find out what this person needs so that I can provide an equitable service for them.
I like how you brought that out. It's winding down to our time, and so I'm going to allow those who are here, if they have a question, you can put that in the Q&A section. But I'm going to go around really quickly, and I would like for you all to give me what is an actionable item that you can ask our public to do in ways that they could put mental wellness and mental health into practice in their everyday lives. So let's start with you, Ms. Wilder. What is an actionable item that you can share with our community about how to put mental wellness and mental health I guess, in the forefront of the things that they do?
I think thinking of mental health and mental wellness as just total, a part of your total wellness and not something that's completely separate and exclusive from, say, your physical wellness.
Mhm.
You're one person, your mind is part of the whole body, treat it that way.
I love that. Ms. Dickey.
That would be my answer. I completely agree. We do have to take care of our mind the same way that we take care of our body, and understand that, okay, well, maybe if I have been neglecting my body and I realize that I don't feel good in my body when I do that, it is the same thing for our mental health as well. So, if you want to feel totally well, your spiritual health is important, physical health is important, and your mental health is as important.
Mhm. I appreciate it. Dr. Hunter.
I would say, think about a time where you felt like you were your best self, and maybe visualize that time. Think about some circumstances of what was going on during that time, and do just one small thing you can do each day to feel closer to that best self again. I would also think about your mental health and wellness like you would an oil change for a car, right? Or oiling up your bike wheels, right? Whatever you may possess that you want to maintain. And think about it like a way to continue to feel well as you can with what you have, and not just a sort of urgent crisis kind of thing. Mental health is not about crises. It's about maintaining as well of a mind as we can and doing the best we can from day to day.
I love that. Liz.
I would say to take every day a 5-minute or more vacation time, mental vacation break, and just separate from the stressors of everyday life, separate from those things that, obligations, and just take a break.
Mhm.
It's okay to take a break.
It is.
Just
It is.
breathe and just enjoy something that,
Mhm.
whether it's a mental picture, it's a mental memory. I'm enjoying the beaches in Puerto Rico right now in my head these days. So I just got back. So there's right there. So, you can have the visual pictures, photographs, I love nature. So that's my getaway place when I need a getaway. And when I need that mental break and that mental vacation, I have pictures of nature. And so that's where I go.
I love that you said that. One of the things that someone taught me, I wish I had it in front of me, but one of a very good friend of mine, she taught me this practice. I can't find it, but any other time, I'm just visualize it. So what she told me to do was, when I was having a mental health moment, so just imagine that this is a straw, and for me to take 10 sips out of the straw, and then and just do my best to try to clear my mind as I'm taking those 10 sips at that straw, and just allow that to just kind of relax me in that space. And then go back to whatever it is that I'm doing, but tackle that one thing. Don't tackle everything that's in front of me, but just tackle that one thing. And then hopefully that can start leading to a space of wellness and feeling better. Before we close, and I want to clear this up. Mr. Washington did not show up, not because of any other issues. As we know, right now, Camp Lejeune is experiencing a great issue with 3 of our Marines that were recently passed in Hampstead. And so he's in the process of helping with that situation. So just remember our military community right now, as they've lost 3 young military men And so if you Google, you can find it in the news about what has recently happened in that space. So just keep them in your mind and in prayers and good vibes for them right now, because that's definitely overwhelming that they're experiencing right now. So we remember them in their space. Thank you so much. One of the things that someone just recently said was awesome. This is so great. You all touched so many great topics. Wow, and thank you. We did address the issue in terms of why insurance is the price that it is, and getting people connected into it, and the limiting the numbers of mental health referrals that you can have. So we did address that. That was a question that came up. So I hope you all have a wonderful day. Thank you so much for agreeing to participate on our Minority Equity Matters, Minority Mental Health Equity Matters space today. I'm still kind of getting my mind together. Yesterday was a very overwhelming day. And so I thank you for your grace that you're giving me in terms of stumbling with my words today. It's definitely been a little overwhelming for me, and I needed this space and time today. I appreciate you all. I hope you all have a wonderful remainder of your weekend. And we will be connecting again soon. Y'all have a fantastic remainder of your day. Thank you again for being on Equity.
Thank you.
Thank
Thank
you.
you.
Thank you all. Have a good one.